In general, central venous access requires strict aseptic technique, proper patient consent, and explanation of the procedure to any conscious patient. Ultrasound guidance is often used when a compressible central vessel is available. In major trauma, however, priority shift and access options are limited. The internal jugular vein in the neck can be difficult to approach, especially when the head and neck area is already occupied during resuscitation. The femoral vein is another potential site, but injuries to the pelvis or abdomen may make this approach unsuitable. In such situations, the subclavian vein becomes the preferred route. Access is obtained using anatomical landmarks. The key entry point is just beneath the clavicle, about 1 centimeter below its curve, with the needle angled toward the sternal notch. This flat entry avoids an excessively steep angle, which increases the risk of pneumothorax. The subclavian vein lies directly under the clavicle, while the artery is deeper and must be carefully avoided. Large bore sheaths or specialized access devices, e.g. a MAC line, are commonly used. As with all central lines, the device must be flushed and primed prior to insertion. Some devices may have a single port, while others provide two. The procedure involves advancing the needle under the clavicle along the bone, then withdrawing slightly until venous blood is aspirated, usually at a depth of 2 to 3 centimeters. The syringe is then removed, leaving the needle stabilized. A guide wire is inserted and advanced far enough to extend beyond the planned device length. After removing the needle, a small skin incision is made beside the wire to prevent the sheath from catching during insertion. The dilator and sheath are then passed together over the guide wire, ensuring that the wire protrudes beyond the distal tip. If resistance occurs at the skin level, the incision should be extended. Once the sheath is correctly positioned in the vein, the dilator and guide wire are withdrawn. Finally, the line is secured, flushed, and dressed in the same manner as any other central venous catheter.